Good morning. My name is Mikey Peres and it is currently 1:30 a.m. here in Miami Beach. I'm going to make a quick video on Finasteride, also known as Proscar or Propecia, and I've done all the homework, so you don't have to. So listen up, it's going to be a quick video. I'm going to be talking about how it works, what to do, what not to do. If you're getting onboarded here with someone with androgenetic alopecia and trying to take control of it, also known as male pattern hair loss, listen up. Okay, so first and foremost, let's talk about the pathway. I'm just going to call it Finasteride. So what Finasteride does is essentially it's an alpha B reductase inhibitor. So what it does is it stops the conversion of testosterone, of free flow testosterone in your blood, from being converted to a more potent hormone called DHT, dihydrotestosterone, specifically in the alpha B reductase pathway. And that pathway is for the most part, the kind of DHT that attacks the androgen receptors in your scalp, which causes miniaturization of your hair follicle over time. Now, it was originally designed, and you'll see this is kind of a general theme within the industry, where a lot of the drugs that are FDA approved in that work were actually discovered by accident, where a side effect and a byproduct of these drugs were hair regrowth, and this is currently how the industry kind of came to be. So by far the most effective method for combating male pattern hair loss or androgenetic alopecia is Finasteride, period, point blank, at least that of which is FDA approved, that we know works, and that is somewhat healthy. And I also want to preface all of this by saying that I am not a doctor. This is not medical advice. You speak to a doctor, get a prescription from a doctor, get all your advice from a doctor. I am just one guy with an opinion. Now, let's do the deep dive. So that's essentially how it works. You take this drug. Propecia is the commercial name, and it's essentially the 1 milligram version of Finasteride, which was originally called Proscar, and it was developed by the company Merck. You take the 1 milligram dose every day, and for many people it slows down the process. For some lucky people it will completely stop the process, and then for extremely lucky people will experience hair regrowth. It's been FDA approved to function around the crown area of the scalp, so around here, but it shows progress even around the frontal area, temple, hairline, so it deals with stuff like recession and whatnot. Now, you take it forever. You don't just take it for a week. It doesn't cure the process. It just treats the process. And what it does is it slows your DHT. It essentially reduces the amount of DHT that flows to your scalp. Now, just a little bit of the study stuff for a moment. So you have two enzymes that will create DHT that will pick up your free flow testosterone. You have alpha A and alpha B reductase. So what they've discovered from research is if you block your alpha A reductase in isolation, nothing happens to hair loss. If you block both enzymes, if you block alpha B reductase, which is what Finasteride is, you see regrowth. And if you block both enzymes, which with a drug called Dutasteride, you see actual tremendous regrowth, really positive results for hair loss. Unfortunately, it's not FDA approved, and the DHT produced by alpha A reductase is essential for brain function, and for puberty, and for all sorts of stuff in your body. So it's not necessarily recommended that you block that as well. But in certain conditions, doctors will prescribe Dutasteride. Something as cosmetic as hair loss, likely not so. However, which we will get back to Dutasteride briefly. This video is mainly focused on Finasteride, but we will talk about some topical stuff in a moment, and this is where Dutasteride will kind of rehash that conversation in a bit. So back to Finasteride. One of the most interesting, what happens really commonly is people who are good responders to the drug and they take the drug, they freak out because what they experience is an increased amount of shedding and hair loss, and that tends to scare people to get off the drug. In fact, that is called, in medical terms, telogen effluvium. And that is also known as shock loss, where essentially your body is responding to the medication in a good way. It's acknowledging that it is growing, it has developed the potential and capacity to grow healthier hair. And when your hair is mid-growth, throughout mid-growth, it can't just increase its hair shaft diameter. So if it notices that there's a change in the hair health, it's going to fall out go to sleep, enter a telogen phase. It's going to exit the anagen phase, it's going to enter a telogen phase, and then it's going to come out again stronger. And the problem is that people who kind of get telogen effluvium, they freak out and then they get off the drug entirely. But the truth is, you really can't see results unless you're on the drug for at least 3 months. It's better off to be towards 6 months, even more, towards a year. So that's just something really interesting to note. And other people experience side effects. So there's all sorts of stuff, erectile dysfunction, there's erectile dysfunction, there's libido issues, there's gynecomastia, that's just a lot of man boobs, for lack of a better term. And just to explain the gynecomastia for just a moment. So I remember you talked about that there were 2 enzymes, alpha A and alpha B reductase, that'll pick up your testosterone. There's a third enzyme called aromatase, which will convert your testosterone to estradiol, to estrogen. And the problem is when you block one of those 3 pathways, if you block any of those pathways, you're going to have more of testosterone being picked up by the enzyme of estradiol. So you're essentially, when you're blocking off one, you're creating more of the other. So in some small amount of cases, people will experience gynecomastia. Some of the side effects are weight gain, but it's really a very small subset of people. And often people conflate just aging with the drug. But for the most part, it's pretty positive. In fact, it was the side effects were fairly minimal when it was used to treat BPH. And all of a sudden, when the hair loss industry picked it up, you had a bunch of people complaining. And I don't know what that says about people with hair loss, but it kind of surfaced where even a phenomenon called PFS, post-finasteride syndrome, kind of surfaced, where a really, really small subset of people were making the claim that even once they got off the drug, their side effects didn't go away. So this is like a little bit into crazy town, but I'm not discrediting anyone. I am sorry to even say that it was in crazy town, but it was a very small subset of people. It was anecdotal, enough of pressure to where I think they put some. No, I don't quote me on this, but they put some mention of this on the label. But for the most part, it's been pretty positive, and it really is the most effective tool to combat male pattern hair loss, where people take it in their early days, before their hair loss is even severe, and they can completely halt the process for decades. So, and there's plenty of success stories. In fact, it's highly used by many males. Many people might not talk about it. Apparently it's taboo, but a lot of people do use it, and celebrities use it most certainly. And anyone who's going to get any sort of cosmetic surgery for hair loss, whether it be follicular unit extraction or strip procedure, their doctors will almost certainly recommend they get on finasteride, because it'll essentially stabilize the playing field. You don't want to get a hair transplant and move hair from the back of your hair that's DHT resistant and put it in the front of your hair when you're going to continue to experience recession, especially for getting a transplant early on in your days. This is why doctors generally won't want to do cosmetic surgery for hair transplants to people who are young, because first of all, your progress can increase tremendously throughout in the next few years, especially if you have an aggressive form of male pattern hair loss. And then it just looks weird when you have your whole frontal side of your head that has DHT resistant hair, but you're still receding on the back. So using finasteride will help stabilize the playing field and give predictive power to doctors to say, hey, I'm kind of comfortable doing this and that, knowing that your progress will be kind of slow. Now one more point here. It's marketed as Propecia, and it's really just a commercial term. They've taken Proscar and they've just removed the 5 milligrams to 1, and they've actually upped the price. What a lot of people do, and it just makes it so affordable, is they just get the Proscar. They get the 5 milligrams. It costs a fraction of the price, and they break it up into 4. So essentially they're taking 1.25 milligrams of the drug. Now, that is definitely the way to go. And people say it's really expensive. Actually, I looked online. If you look at the generics, they're really, really cheap. Strangely so, like a few dollars for a whole month. Now, there is a phenomenon here where people who have been engrossed in the industry will promise by the fact that you should always take the Merck, the name brand, rather than the generic. And even doctors don't necessarily recommend this, and definitely pharmacists don't really even understand why this is important. But essentially, in order for a drug to be considered legally the same, the actual chemical structure has to be the same, but the delivery vehicle and how it's delivered to your body can be radically different, and it can still meet the criteria as a generic. And we know this anecdotally because people who were on sorry, just one moment. People who were on the name brand and switched to generic, this is anecdotal, but they have experienced shedding and hair loss, and it's almost like they've lost a lot of ground, and they immediately went back on the name brand. So you can speak to someone like Spencer Coburn, who operates the IAHRS, the American Alliance of Hair Restoration Surgeons, and the American Hair Loss Association. He's even got a show called The Bald Truth. He's a person who's extremely wise in this industry, and he's someone who wouldn't talk about this quite often. So this is definitely something for you to note. Now, also people who have experienced having side effects with the drug, a common tactic to get on it is to wean on it slowly and to wean off it slowly, should you want to wean off it, of course. But so let's just say you're prescribed with 1.25 milligrams, you're chopping that Proscar up into 4 pieces, and you think you're feeling some weight gain or you're having some libido issues or whatever it may be. What you can do is break it up into smaller sections and kind of wean on, get like on a 0.25, 0.5, 0.75, and 1 and 1.25. And people who have done that, reading on various speaking to various doctors and also reading online, people have mentioned that although they initially felt side effects for the drug, they were able to adjust to it kind of nicely, and they felt they no longer had those side effects. Again, speak to a doctor, but this is just information for you to consider. Now, I know I said I'm going to make this about finasteride, but finasteride is, let me just say one more point here. It's meant to be taken orally. Now, with the recent kind of commercialization, and there's been a lot of this industry itself has been a $3 billion industry, and it's kind of like a snake oil industry that made it. There are very few things that work, but one thing that does work is what is FDA approved. You have Minoxidil, which is Rogaine, and you have Finasteride, which is Propecia or Proscar. Those are FDA approved and they work, period. I would say Rogaine is more of a band-aid. So what it's doing is it's increasing the potassium and blood flow to your scalp. Well, we're not entirely sure how Rogaine works, but essentially it's a drug from Johnson & Johnson, and it was originally used to treat hypertension or high blood pressure. And what they've noticed is hair regrowth. How we believe it works is that there's a higher blood flow to your scalp, and there's also more nutrients, some higher potassium flow to your scalp. So since there's an increased blood flow, I know this sounds a little bit weird, but it makes it a little more difficult for that DHT to bind to your androgen receptors. So it's more of like a band-aid to the problem, but it works in confluence very well with finasteride. But essentially, finasteride is like the king. Look at everything else as being secondary, and if you take finasteride, everything else kind of has a more of a compounded positive effect. But if you don't take it at all, you're really doing minimal progress to a much deeper problem. So finasteride will attack the issue hormonally, while the others will deal at a very surface level. Now, at a very quick comment here, for 30, 40, 50 years, finasteride has always been done orally. The actual structure of finasteride is kind of big, so it makes it a little hard for the scalp to absorb it. But recently with Hims and Hers and this commercialization of all these products, we've seen kind of like an explosion or Cambrian explosion of innovation and creativity and competition. So we're starting to see drugs like finasteride entering the market and being taken topically, and it helps if you have a delivery vehicle, something like microneedling, so creating small little damaging the surface layer of the scalp and inducing growth factors to that area, but also increasing absorption to the scalp. So when people do microneedling, it helps create growth factors on the site at one fold, and it also helps increase absorption for anything that's on the scalp. So people using delivery vehicles like that have seen higher absorption rate for finasteride and Rogaine, which essentially is applied topically. We're also seeing a flip where doctors are starting to prescribe minoxidil orally, which is kind of interesting. So you're seeing people take minoxidil orally and topically. I know this video is not about minoxidil, but the thing about applying it topically is you're kind of really targeting in and you're honing in on a specific site where you want the effects, as opposed to taking it orally, where you're going to see you're going to experience hair regrowth throughout the entire body. So that's just something for you to know. But and some people might have side effects with taking finasteride orally, but they don't have side effects doing it topically. Sometimes people have been taking finasteride orally for a long time and they want to take it topically as well, and they see even better effects when they take it topically. But it's a very slow process. And keep in mind, you don't want to get in my opinion, you don't want to move too quickly with these treatments. So what you want to do is work in isolation, because think about it this way. If you take 5 different medications and you go and you do oral, you do topical, you do minoxidil and finasteride, and you kind of got a whole concoction going on here, and you're seeing good results, which is all great now, but you really don't know what is the one giving you good results. It could be that you're taking 2 other drugs, and you definitely don't want to take drugs if you're not supposed to. I know, there's data that says it's fairly safe and it's FDA approved, but we really don't know long-term side effects, and whatever you cannot take is great. So when you take all these drugs now, and it's like, now you want to kind of tone down, you don't know what works. You don't know if you might think it's the finasteride, you might think it's the minoxidil, but really, unless you work in isolation, where you try something for 3-4 months, you can do a fair assessment of what works, and then kind of try something else, and then kind of add to your daily routine. But it's like brushing your teeth. You're doing it for every day for the rest of your life, or at least until something much better comes along. And that's a secret. A lot of these, people would think you're taking it for life, and you can work under the premise that you might be, but the truth is you just want to take it for 5-10 years until better treatments come out, and hopefully they do, and you're in a better position, because it's much, much harder to get hair back. It's radically easier to maintain what you have. So jumping on this earlier is not always a bad idea. Getting on this in your 20s, getting on this, before, when you have a full head of hair, but you're noticing those telltale signs of recession. You're noticing the miniaturization, thinning. It's not just about recession or having a crown. You can be a diffuse thinner, meaning that you're per given area, you're experiencing less amount of hair follicles, or your hair shaft diameter, the thickness of your hair follicle is decreasing. So those are all signs of experiencing hair loss, and you're likely the first one to know it before anyone else. So jumping on the problem early is great. Working patiently and diligently and staying focused and assessing what works is great. Getting on something that you can afford, that you can budget, something that's just economically friendly. So I'm not necessarily telling you to get the name brand, but if you can afford it and you've got a good paying job and you can afford paying a little more, or you live in a country that it costs a lot less, or it's covered by insurance, then definitely get the name brand. But the generic is what's prescribed for the most part, and it seems to make a lot of people happy. So, and it costs just a few. I actually literally just Googled it before I got on the video, and it's like $6-7 a month for a prescription of 1.25 milligrams a day. That's not very much money. It really isn't. So, and try it out. You don't have side effects. You feel good. I mean, you make your own decision. You speak to a doctor. But here are just some of my opinions on the process. What else is there to talk about? You definitely don't want to get off it. And if you're experiencing shock loss, if you're experiencing a noticeable increased rate of shedding, that's a really good sign. I know that sounds backwards, but it is. It means that your body is responding to the medication, and usually people who do see really good results in the next few months. Maintaining what you have is a win. It's progress. Reversing the process is you hit the jackpot. That's great. It's a little more, it's not like that rare, but it's an absolutely good result. And if you're not a good responder, you can start to resort to other options. You can resort to minoxidil. You can try topical finasteride. You can try platelet-rich plasma, essentially extracting blood from. You go to a dermatologist. They take blood. They put it in a centrifuge. They separate the platelets and they re-inject the platelets into your scalp. And those platelets induce growth factors. You can do microneedling. You can look into FDA cleared, not the FDA approved, radically different. But you can look into FDA cleared using low light laser therapy. So that's essentially light at around 560 to 580 nanometers, red diodes and lasers, and those induce growth and increase the blood flow and increase the nutrient flow to the scalp. And they have these like caps. So they don't work tremendously well, but you don't, first of all, you don't know what you're a responder to. You don't know what you're a good responder to. And sometimes doing things in confluence, doing things together really do compound good results. Then there's using ketoconazole, which is an antifungal shampoo, and also eating healthy and reducing your sugar in your blood. These are things that if done for a long time and again, this is stuff that you have to like integrate into a natural part of your life. I can't stress that enough. If you do this for 2-3 months and you stop doing it, you're essentially going to hit equilibrium really quickly. Hopefully that's just a handful of information for you to take.